I'm Dr. Johnson. This is Behavioral Health Services Delivery. Let's talk about integration. Integration, this means fusing medical services with behavioral health services. As of now, we don't do a good job about communicating between behavioral health professionals and physicians or primary care physicians. But behavioral health is equal to overall health. Behavioral health results in overall health. It's intricately connected. When we do not communicate, we are taking the human body and dividing it between the physical body and the behavioral health or the mental body. And we need a whole person-centered approach. So in order to do that, we require integration, fusing these services, medical services with behavioral health services. Now, a little small anecdote. I call it sunshine and beer pong. During my UF days in Gainesville, I went to visit my primary care physician, lovely young lady, amazing doctor. And I went to see her because of it's sun poisoning, but the medical term for it is photodermatitis. Photodermatitis, essentially sun poisoning. During that visit, she screened me using SBIRT. She gave me a screen about my substance use. She gave me a brief intervention, and then she referred me to further services. This was the integration of behavioral health matters with my physical health matters, with my primary care matters. Because of this integrated approach, she was able to see that I frequently drink alcohol socially. And because I drank alcohol, she was able to detect or to deduce or diagnose that my photodermatitis was linked to dehydration. And that dehydration was exacerbated by alcohol use at graduate student socials, beer pong with the bros. All of these different sort of activities were actually exacerbating the underlying health issue, which was dehydration. Because she used this approach, she, in one visit, was able to address my physical health, my dermatological issue. She was also able to address my behavioral health issue, alcohol consumption, socially, too much of it, especially in the context of dehydration. This is the gift of integration. Challenges. Big challenges. One of the greatest challenges over the past 20 years has been chronic medical problems. One of the greatest challenges that we've had. Chronic medical problems such as obesity, heart disease, lung disease. These are some of the biggest challenges we have. Now let's think about behavioral health care in the context of COVID-19. This is one of the most relevant courses you could possibly take in the context of a COVID outbreak because your behavioral health is linked to some of the critical risk factors that place people at risk for fatalities concerning COVID-19 infection. Psychiatric disorders are associated with 3 times the rate of diabetes, 10 times the rate of heart disease, and 40 times the rate of cancer. Psychiatric disorders, that's behavioral health. That's behavioral health putting folks at risk for viruses like COVID-19. So it is critical that we consider the connection between behavioral health and our physical health. And this is the reason why psychiatric epidemiology is just as important as the more famous viral epidemiology that's now in the mainstream media. This is the reason why Dr. Johnson is equally as important as Dr. Fauci. Probably not as popular, but the behavioral health, the point is the behavioral health is just as important, if not in some cases can be more important as a preventative factor than some of the more famed or prestige sort of viral outbreaks or epidemics. Okay, so major depressive disorder is associated with 10 years lower life expectancy. 10 years off your life on average for folks with major depressive disorder. This is your behavioral health impacting your life. Not just the quality of your life and the days that you live, but literally whether you live or die. This is critical. And another major challenge, other than chronic medical problems, are performance measures. Performance measures in the context of healthcare. They're lagged, they're delayed, in some cases they're non-existent. We need data. We need performance measures. How well are we doing? How effective and efficient is the healthcare that we're providing folks? This is a critical matter, and we'll discuss this briefly today. And of course, the big one that we've talked about throughout the course, healthcare costs. That's the big challenge in the context of the United States and most places around the world. Some people have got a handle on it, but most people struggle with healthcare costs. That's our number one challenge, is the underlying theme throughout the course. Solutions. Number one is going to be integration. Integrated team-based care models. We're going to discuss three, but there are various types. They overlap. Sometimes it's not really clear how to distinguish between them, but these are the big three that we're going to talk about today. And these are recent developments. So, number one, collaborative care model. A collaborative care model is an evidence-based model. We have scientific evidence showing that this model has been effective in improving outcomes, behavioral health outcomes, and physical health outcomes. Primary care behavioral health models. So let's try to distinguish between the two of these. The collaborative care model is a team of physicians, a team of behavioral health professionals coming together with this charge. Sort of think of the behavioral health treatment, or the behavioral health aspects are being led by the primary care physician. This is not in stone. With primary care behavioral health models, the behavioral health is led by a behavioral health professional. Okay. And thirdly, we have primary care for patients with serious mental illnesses. This was a little bit clearer because you're able to see that the location here is within the behavioral health settings. So it's also called reverse location or reverse co-location, because co-location is associated with putting the behavioral health care professionals into the context of primary care settings.